So I want to welcome everybody here to the Community Foundation. Good? Everybody hear me okay? I'm Alicia Dix, President and CEO of the Community Foundation, and again, I want to welcome everybody here today. We have been plagued in this community for decades with unhealthy housing and lead poisoning in children. And in 2016, our board of directors made a very conscientious decision to put something together and battle the lead poisoning issue in our community, and do it with laser focus. And I want to recognize we have some trustees here that we wouldn't be here if it wasn't for our board of directors. So thank you, Eve, Dave, Cheryl, and Dave. We have two Daves here. Our board is really the visionary here to make sure that this work gets done. They did something very different in 2016. They said that we need to really, like I said, hyper-focus, get this community working together and figure out how we can bring those rates of lead poisoning down in a meaningful and impactful way. And this coalition, the Lead-Free MV Coalition, was the result of that initial commitment. And for years, we call our lead team the Lead Heads. We have 3 people dedicated, and many of you know them. We have John Monaghan, Nancy Zappone, and Caroline Williams. Where are they? They're probably hiding. Oh, they're there. Okay. Oh, you guys are nice, evenly dispersed. Very nice. Very strategic. So our lead heads, our lead team, has really been behind the scenes coordinating this coalition that we have been so fortunate, and we're grateful for all of our community partners stepping up and getting involved and staying and sticking through the work of the coalition. It's been very important to have that coalition work together. Everybody was doing something, but together we can do a lot more and find out how there are opportunities to do things that we weren't doing in the past. And one of them is really kind of why we're here today, is really enunciating that teamwork. It's interesting that we're here the month of June. I think it's the National Healthy Homes Month, right? Yep. So it's great timing for us. I want to acknowledge that we're appropriately here in the right month of the year to celebrate the Green and Healthy Homes Initiative. I want to thank those agencies that have been a part of this. A lot of them you see up here who have been signing the contract and have been here for months going through the GHHI training, very committed and very dedicated. And again, it doesn't take much to say, I've got other priorities and walk away from the table. I really commend all of our partners. We wouldn't be here without you. And without the county, the city, the county agencies, Community Action, all of our friends, Home Ownership Center, we're here because of you, and thank you for that commitment. I want to take a moment to also recognize a few of our elected officials that have supported us, not through just this initiative, but through our past HUD grant application that we worked with the City of Utica, and a lot of them were instrumental in trying to get that HUD grant secured and approved last year. So I believe we've got Joe Nemi from, there you are, thank you, from Senator Schumer's office, Grace Bobberts, thank you, and Kayla Anderson, sorry, there you are, Kayla, from Senator Gillibrand's office, Sarah Borman from Bendizzi's office, Carolyn McAleese, where are we? Thank you, from Marianne Buttonshaw's office, and anyone else? We're good? Okay. And of course we have our elected officials up here, but I'll be introducing them in a moment. I really want to recognize my staff. I know that every time I have the opportunity to talk to our Lead-Free Coalition members and partners, they're always talking about how great our lead heads are. But our lead heads are also supported by our entire Community Foundation team. Kayla, Mary, all of our team members, Jackie, really put this type of work behind the lead heads to the kind of quality that you see today. So I want to thank our team. Our whole staff participates with lead. It's not just our lead heads, but they're our leads. So thank you to the staff of the Community Foundation. So collaboration is key. We are working towards a common goal, actually, and obviously, and lead is what I say got us to the table or through the window. What we realized when we got into homes is that if we solve the lead problem, we have all these other problems that are still existing for these families that are not healthy. So the Green and Healthy Homes Initiative really became of interest to say, all right, how do we comprehensively address the needs for a healthier home and make our communities and our neighborhoods better? So as I said, we've been working with GHHI for months to really partner and build this coalition and build this declaration today. We have everybody here to collaborate. We've aligned many agencies and services to achieve what we believe will be greater impact. So yes, we're in there for lead, but we want to make sure that asthma hazards are taken care of, mold, whatever environmental issues are there in a home that would cause some health issues, we want to be able to contend with them. And this platform that we're on with GHHI will give us that opportunity. So it is a great day for our neighborhoods in our communities that are really suffering for some of these environmental hazards. So we're all in this room together and dedicated to addressing some of these long-standing community issues. And I think the proof of everybody's signing this compact today is proof that our next step together, we will have a much greater future. And hopefully within 5 to 10 years, we can celebrate huge reductions in lead poisoning, huge reductions in asthma, and so on and so forth. So we're really looking at those outcomes from this coalition work. So I have a few people I want to introduce and say a few words on behalf of the GHHI initiative that we're here for. First, I'd like to introduce our county executive, Tony Pacenti, who's been a champion of lead for over a decade and has really been instrumental in pulling this coalition together. So thank you, Tony.
It is really a pleasure to be with all of you today and our partners. And our partners as we move into kind of a next phase, but really, the signatory of this agreement, and it can never be overstated that there's strength in numbers, and the numbers that are around this table and the numbers that are out there in this community that continue to look at this issue and continue to fight it is important. As Alicia said, one of the first things I did as county executive, one of the major initiatives, first initiative really, was taking lead prevention to a primary level. It was a secondary program in our health department, and now headed up by Phyllis Ellis and the great job everybody in our health department does. It has been a primary program, and getting across to our neighborhoods, not just the City of Utica, throughout the county, and clearly, when the Community Foundation wanted to embark upon this, it was the greatest news we had heard as well. And joining together, makes it even better. Lisa touched on a few points about what this does, for a community, and it shouldn't be looked at that that in any way, shape, or form, that that there's this stigma. Older communities across the United States have had to deal with these issues, and as time went on and housing changed, these things just got covered over like everything else, and it wasn't any one individual's fault. It was just kind of part of what happens in the cycle of life and of communities. So looking at this and dealing with the issues of lead in our communities, but also expanding it, and through Ruth Ann and GHHI, I can't thank you enough for partnering with us and bringing this all together. It really does move a community into looking at things differently. I hear it from people all the time that whether they're rehabbing buildings in the cities, in particular in the City of Utica and others, about all that they've learned about what needs to be done. But it goes beyond that. It's about all of our healthy homes. It's about doing everything right, as Alicia said, in terms of the aspect it has on public health. I would also add the aspect it has on mental health. Some of the studies of lead over the years have shown that communities and issues have been exacerbated by lead paint in children that have had learning disabilities, that have had behavioral issues. And those cannot be discounted as we look forward, as we look ahead to fixing and to really making this a totally healthy community. So again, to all the partners that are here, I thank you. Oneida County stands tall and with you, and again, strength in numbers. Our work with the city over the years in the aspect of housing has been critical, and we continue to do that. And to the foundation, GHHI, all of our partners, Cornell, everyone gathered here, the home ownership community action, thank you, and we look forward to more good things to come. Thank you.
Our next speaker is going to be Mayor Palmieri, and before I ask him to come up, I wanted to mention that this is such a deep-rooted issue for our community that our board of directors recently took that initial 3-year, $1 million commitment and stretched it to a 10-year, $5 million commitment. So we are in it for the long haul. But again, we couldn't do it without every one of our partners. County has a critical role, but when we look at the numbers of lead poison circumstances, we know they're hyper geographically focused in the city of Utica. We know we have issues across the 2 counties, but Utica is the one that is unfortunately at risk at the greatest number. So it is a great benefit for us to be partnering with the city at the depth that we are, because that's where the problem really needs to be fixed. So, Mayor?
Good afternoon.
Good afternoon, Mayor.
So, just as a sidebar is the fact that you can see the partnership and the collaboration that we have along with the county executive and everybody in here, that we could actually, we come together and we look for what is a problem in our community. And as I embark on our quality of life sweeps each and every week for roughly 10 months out of the year, and we're talking about a health hazard that, quite frankly, you can't see it. You really don't know it's there. And obviously we do, but the people that we're dealing with are not aware of it. So for us to come forward at this point with a consortium of people to prevent any further deterioration says an awful lot, not only for our community, but for our partnerships that we have as we talk. And I can tell you firsthand, when we are on the sweeps, and multiple times we've had people along with us to educate people, to help people. Not only are we helping the people, but they all understand there's hope out there, that people really care about what's going on. And the fact that there's funding out there, and now that we're talking about sustainability of over 10 years, that's something that really brings hope to these young little kids that are out there that may not be aware of it, and to the parents that are out at this point. As we're changing the complexion of our city and our county, without this type of partnership and this collaboration, and we joke about it, but it's for real. And we are going to be changing because we have sustainability at this point with the lead program. So when I'm out there and I'm talking about the mold, the quality of life that people don't understand, and then you bring people to the forefront that are educating them and changing these minds, not only are you abating the problem, but you're giving these people, all of our community, the understanding that there's help, that people really are committed to changing the fiber of our community. And I look at our community as sometimes a little bit different than anybody else, because we always come together. We're a very loving, giving community. But the fact that we have this group that's together, and the Community Foundation, it's always at the forefront. And then we work with other elected officials that understand the needs that we have. I think it's remarkable at this time and where we are in our region, and our county, and our city. And I want to just say to everyone that's part of this, I thank you very much for changing not only the health, but the psychology out there of the people and the psyche, that the people, there's help, there's people that care about you, and we will change the fiber for the next generations. Thank you.
So the lead issue is complicated, we've talked about that, and it is, at a national level, very diverse in where we can get some support, where we can actually get some funding, what are the tools we need to really combat lead as a coalition. And we were really fortunate to team up with Green and Healthy Homes Initiative, and we've had Wes Stewart, right, and Van Norton here, come to town on occasion to help us through the whole technical aspect of building the GHHI model here locally. And we're so fortunate that Ruth Ann was able to make it today, albeit she's been up since, what, she got in at 2 in the morning. But we're really, really thrilled that she can join us today, and if you kind of come up here and share a few thoughts. Thank you.
Utica, right? Fantastic. And as a New York-born girl, and this being my birthday week, thank you for a wonderful birthday present coming home to New York. I want to just, I have to start with the Community Foundation to say thank you to Alicia and to John, superstar extraordinaire to work with. But to the trustees of the foundation, I want you to understand your leadership in a $5 million investment, what that means as a beacon to other community foundations, to other communities across this country, but what it means to why we're here is astonishing, is wonderful, and on behalf of my work and the many people who do this work, in my 26-year history working with community foundations, there's never been a bigger commitment by a community foundation in this way and with its people and at the quality of this. And so I think we should all acknowledge this. To the mayor and the county executive, just thank you. Just understanding and being knowledgeable about the problem, feeling that problem and putting it into action. What we're here to talk about today with our partners is really outcomes. Outcomes for the kid who will go to school and be able to be healthy and ready to learn, who will compete in the classroom because they're not lead poisoned and because they're sleeping through the night without asthma. And being able to change that statistic and make it an opportunity is incredible, and it takes political will and it takes leadership. So thank you very much for that. And thank you for allowing me to join you on one of your quality of health days as well, but please thank the mayor and the county executive, if you don't mind, again. But this is about, what we're signing today is about a partnership of the work that we will do. Now, everybody who's been through the triage meetings and has spent so much time with Hirsch Fernandez, our wonderful friend and partner, with Wes Stewart, Wes has been with me for 23 years, so he gets sainthood, for sure. And Catherine Lee, who you're now working with and you will fall in love with, I am sure. This is a marker of the work that we will do together, that we will be shoulder to shoulder with you on. I'm so pleased that you're going to be getting other support and resources from our friends at Robert Wood Johnson and other technical resources there. I said it's a great compliment to the work you're doing that people now want to come and seek out what you're doing. My goal is that these are big things to happen. And so for our congressional representatives that are sitting in the audience, there is a bill that is being circulated and drafted, led by Jerry Golden out of Maine and Elijah Cummings in Maryland and others, and we welcome. And on the Senate side, many supporters. But it is to establish a $12.5 billion lead remediation fund and to say to the country that in 5 years, we can virtually eliminate lead poisoning as a major public health threat. Communities like Utica will thrive and propel so much more in the future. So I openly seek your support for that legislation to help put your names on it. We will be happy to talk to you about that. And also the Lead Safe Kids Act that we are working on and have helped to craft, that's in Congress, to ensure that kids in public housing get treated with the equal opportunity for safety that we afford in private housing. We have to level the playing field moving forward in communities. Housing is the way to do that in many ways, because housing is healthcare. And this is a state that is recognizing that housing is healthcare and the convergence of this for outcomes. And so I'm extraordinarily excited to be a part of that. And I just want to say that there is a lot of work ahead for John and Nancy and Carolyn and all of our partners that are sitting here. But there's a lot of unity in that work. And for somebody who started in 1993 in a job that I said I would to help a small organization that was moving from Parents Against Lead to the Coalition in Childhood Lead Poisoning, and I said I'd work for 2 years to help them get organized. 26 years later, I still stand here because of impact. Impact matters. I come from a city where we've reduced lead poisoning by 99%, so my challenge is beat us, please. And for those who care about this, and it matters, what we return to the Maryland economy is $44.5 billion in economic return. But I think the challenge is something we didn't know when we began that journey, but on this journey, is that those outcomes about school performance, about quality of life for our kids and our seniors, about what we return on economic outcomes, must be invested in the communities that have suffered, must be reinvested as jobs, must be reinvested in the education support, and must be reinvested in the neighborhoods where the problems that we are solving exist today. And everything that we can do to help you in that, every step of the way, will be here. We are grateful for the opportunity to partner with you, and grateful to each of you as we endeavor to make the lives of our communities and our neighborhoods better. So thank you.
Okay. Thank you, Ruth Ann, and we're going to beat you. I like a challenge.
I like it too.
So the coalition that we built from the beginning has really had some tremendous leadership, and it is like an honor for me to introduce Dr. Werfel, who's been a bit of a statesman in leading the coalition as our chair. We have some champions from our trustees who participate, but Dr. Werfel really does a tremendous job of keeping our feet to the ground and working through all our projects. There's a lot of discussion on testing and piloting and testing projects to see if they come to fruition. I see there's giggling because it's a lot of work. And I'm always amazed that all of our partners keep coming month in and month out to test and challenge our ways of working to try to get underneath this lead issue. So Dr. Werfel, if you'd like to join me, and I'm so thankful for your leadership, so thank you.
Thank you. Good afternoon. Thank you for coming to witness the signing of this important compact with the Green and Healthy Homes Initiative. I relocated to Oneida County 31 years ago. 31 years ago, I encountered my first child with lead poisoning. I worked within my practice to screen and identify children at risk for lead poisoning and really to try to have an impact. But that impact and strategy was meaningful, but it was pretty limited in what I could get accomplished. So years later, when Alicia approached me about the Community Foundation's interest in addressing lead poisoning, I really appreciated the opportunity to help address this important health issue. It's been very gratifying for me as chair of the Lead-Free MV Coalition to witness the power that comes from multiple agencies working together to address one of the toughest challenges in our community. I commend and thank all those who've engaged in this work of the coalition and GHHI, which has enabled actually an exponential amplification of that impact, and that's really important. Child lead poisoning is certainly undoubtedly a very complicated societally issue. It's complex. I think we all understand that. The health effects of living in older housing stock that predates the 1978 federal ban on lead-based paint, though, can be catastrophic. And the data on that is very clear. So I work for the Mohawk Valley Health System Sister Rose Vincent Family Medicine Center, and we're located in Cornhill in Utica. We train family physicians in our residency, and we treat patients of all ages. We see the effects of lead poisoning and how this toxicity negatively affects the trajectory of a child's life. We also see the health conditions that this kind of housing has on illnesses such as asthma and household injuries and safety, which can affect people of all ages, and that in turn affects all of us. So we can treat many of these problems, but it certainly would be better to prevent them. GHHI Utica-Oneida County will help families address the root cause of health concerns by removing the health hazards from our home. Prevention is better than treatment. Improving the health and welfare of our community and protecting the next generation should be a priority for all of us. This effort will work. It will protect children and families of our community. Thank you for joining with us and for your continued support in our efforts.
So now the fun part. So the ceremonial signing of the compact, we're going to have each of our signatories here do a ceremonial signing once I call your name. And again, this holds us all accountable to working together and getting this work done and beating Ruth Ann's community's numbers. That's our new goal. 100%, not 99.95.
That's right.
Okay. So, Anthony Pacenti, County Exec, would you please sign? I have a fancy pen too.
Great. Mayor Palmieri? Ruth Ann Norton? Dr. Werfel? Danielle from Homeownership Center? Critical. Oh, critical partners, every one of us. Yvonne, Mohawk Valley Community Action. Phyllis Department of Health Department, what do you call it? Oneida County Department of Health? Public Health, I knew I missed a word, sorry. Oh, I'm sorry, and Mary Beth from the Cornell Cooperative Extension. You guys are quick. So, we're accountable, we're fighting. I'm gonna sign it last. All right, I'm gonna sign it now. I like the accountability, perfect. You learn well. Can I use your pen?
Ready? Eve was looking, waiting for you to sign.
Signed.
All right.
Compact is signed, we are in agreement. So there's a lot of work ahead of us. We can celebrate today, but we're gonna go right back at it tomorrow, right, John? Yes, okay. So thank you all for being here. Thank you to our partners for being up here and taking a stand against unhealthy homes. All right, thank you. Thank you for coming.